everybody, I'm Elisa. Welcome back, and we're doing the digestive system. So we started on the mouth a little bit, and now we're going to continue on with the rest of the mouth, and we're going to start talking about the tongue. So the mouth has some components we're going to talk about. The oral fissure is the fissure or the opening between the lips. The fauces is the posterior opening to the throat. So generally we're going to have a lot of the stratified squamous epithelium because there's like just a lot of abrasive activity that's happening in the mouth, whether you're chewing on something or it's the chemical secretions as well. So say you have some super hot Sadie salsa and some super pokey rugged chips, you're going to need some protection. So these areas, because of the squamous epithelium cells, stratified specifically, they're very highly keratinized or keratinized um, because of that food abrasion. And so this is going to be on the gums and the hard palate and, different parts. Non-keratinized are other areas. So this is going to be like the floor of the mouth, the soft palate, and the inside of the cheeks or lips, which are more subject to being like damaged. Here is the oral cavity in all of its glory. So we have up here the upper lip, we have the lower lip. We have the superior labial frenulum, right? Oh, it's their little frenulum right there, just kind of holding things down and together. So labial means lips. Superior means it's on the top. We also have an inferior labial frenulum, boop, right there, as well. So the area that's kind of like tucked up under your lips, right in here, right, this is known as the vestibule. So this works like that would also be down here as well. So it like kind of up in that area. Okay, the hard palate and palatine rugae. So like rugae means there's kind of these rough ridges right here. This is palate itself. The palatal glossal arch is the big one at the end, back up here. Palatopharyngeal arch is going to be the one that's actually in the pharynx proper, right? So it's when we start kind of saying like, oh, we're out of the mouth, we're in the pharynx, and that also provides us the location of the palatine tonsils. If you got your tonsils removed because you were a kid in the 80s, that would be the tonsil that they generally took out, those right there. The uvula of the soft palate is the hangy ball down here at the bottom part of the mouth. And the tongue is the large, quite dexterous muscle that is moving around through the mouth. So that's like helping you breathe, it's helping you talk, it's helping you swallow, it's helping you mash up food, all that good stuff. A frenulum again exists here on the tongue, right? That nice little like piece of connective tissue that's going to keep us connected to the base. Um, Salivary duct and orifices, right? So if you look at like right at the bottom of the tongue, this is where a lot of these ducts like open up. And man, can they shoot out or gleek out, as some people say, saliva. Right. So when all of a sudden your mouth just starts really salivating, there it is. That's the stuff. It is sublingual, meaning it is under the lingual or the tongue. And then here is submandibular, meaning they are right down here under and attached more to the mandible, which is the bone that is holding together the jaw or the bottom component of the mouth. All right. So you got some cheeks and you got some lips. So these are the soft, flexible like areas of your mouth which close, encase, expand, and contract to help manipulate in order to breathe, chew, eat, and even store a little bit of things here and there, like some gum that you're not supposed to be having in your mouth, right, when you were a kid. Okay, so they retain the food and they push it between the teeth. They are essential for speech, also for sucking, blowing actions, including suckling by infants big time, the use of a straw, slurping your soup, all of that good stuff. Also, let's see here, fleshiness due to the subcutaneous fat in the buccinator muscle. So, like buccin, anytime you hear this, is cheek, right? Buccal, right? Buccinator muscle of the cheek. And then the orbicularis oris of the lips. So like orbit, right? So think of like the orbit of the mouth. It's kind of like a sphincter in a way, right? And then oral cavity oris opening. So this. Okay, the labial frenulum, we talked about that, the medial fold that attaches each lip to the gum between the anterior and incisors. And we talked about the vestibule right under the lips, right, where you would tuck it right in. So it's space between the cheeks, or the lips and the teeth. The cheeks and the lips, now I want to say chicks, like baby chicks, like cheap chicks. Lips are divided into three areas. So there's the cutaneous, right, which is like the cuticular area, and it's colored like the rest of the face. It has some hair follicles, some sebaceous glands. There's also the red or the vermilion area. So this is the hairless region where the lips actually meet. So a lot of us think of this as like labial proper. It's tall dermal papilla that allows blood vessels and nerves to come right up close to the epidermal surface, and it's like a super sensitive area. You can actually just touch wise, especially, um, and it's sensitive to other types of things like moisture, water, wetness, dryness. Um, right, so it's very sensitive to that. So it's redder and more sensitive in the cutaneous area. The labial mucosa, which is the inner side of the lips, which is facing the gum and the teeth. And since it's like labial meaning lips, and then mucosa because there's like quite a bit of secretion in that area. The tongue is a big old muscle. It's bulky, it is remarkably agile and independent. It's a very sensitive organ. It manipulates the food between the teeth. As well as like helps you drink for, your water. It helps you sense through taste and also feel the texture of food. Non-keratinized or keratinized stratified squamous epithelium covers the surface. There are these little papillae, right, which is like a finger-like projection. So these bumps or projections that are the sites of most of the taste buds. And so for the large scale or like the body of that tongue, the anterior two-thirds of that tongue is going to occupy the oral cavity proper. But the thing is like the tongue actually kind of like goes back into the oropharynx itself and kind of like digs deep into the throat a little bit. Um, the valate papillae is a V-shaped row of papillae that are going to mark the boundary between the body and the root of the tongue. So it's like a very visual thing. You can actually just see it. So the terminal sulcus is the groove behind the valate papillae, right? You can kind of like see the tongue kind of going here. Sometimes, especially in like infants that are drinking a lot of milk or they'll get kind of like a white, like kind of layer there, right? Can get kind of stuck. The lingual frenulum is that median fold that attaches the body of the tongue to the floor of the mouth, just helping to stabilize it as well. Intrinsic muscles are contained entirely within the tongue, and they produce little, uh, like little tiny movements of speech, like just like because they can move like these fine movements. However, the extrinsic muscles are going to be the ones that attach on the outside of the tongue, and so these are going to be like the big movers, like the chewers and the squishers and all that good stuff. So they are known as genioglossus, hyoglossus, palatoglossus, and the stylo or the pen-like glossus muscles. Like, see, there's a lot in there. The lingual glands consist of the serous and mucus glands, and they're generally found in the extrinsic muscle area. And they're going to secrete part of the saliva, right? Saliva containing especially things that start, enzymes that start breaking down, like sugars such as amylase would be one of those enzymes. The lingual tonsils contain the root. Okay, so that's it for right now, and we'll continue on a little bit in the next video. In the meantime, I hope you're all out there having a great day somewhere, and we'll see you later. Bye.